Yes, sir, I can hear you, sir.
All right. So about Dr. Akash is not my course candidate, but Dr. Akash is there from the very beginning when he started to prepare and he joined every mock. Okay. And he purposefully asked me all the questions he has doubts. Okay. In all the mocks, he asked me, what is that? What is that? And very nicely, he passed his exam, and I'm very, very happy. And I knew that he's going to pass. And also, before his exam, he was super stressed and he was saying, like, I think I am not going to pass. I said, don't worry. I knew, and you join the mocks, and I take your mocks almost all the stations. He knew ins and outs. Okay. So I said, no, you are going to pass. I know when I take the mocks, the way you guys deliver, I can understand who is going to pass and who is not going to pass, right? Because it's just about experience. So I knew he is going to pass. And I said, like, don't worry, do your best, be yourself, don't stress out. You are going to pass this. Okay. So here is Dr. Akash. Dr. Akash, please share your experience with us.
Yes, sir, thank you for introducing me. Actually, first of all, sir, I would like to thank you for helping me out in all my doubts. Actually, I had all the doubts. So, sir, to start with, I want to share why I could not join your course.
No, 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 it's
Actually,
fine. It's
like,
fine. Don't,
yeah,
don't, don't.
yeah, yeah.
It's fine.
No, 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 sir. I'm not going in detail. Like Dr. Uma Harshal and many other candidates. The day I joined, unfortunately, in another course, then I came to know about sir. Then for that, and I had some issues, so I could not join the course. But sir has always been there. And sir, I'm actually surprised by the passion that with which you teach all of us. I mean, the attachment that you show to each and every student, not only me, not only anyone, to each of them, and being available all the time is all that what a candidate need. And your teaching is really it's the best teaching, not only for the MRCS, even for the NEET or MBBS. When I was studying, the way in which you teach all of us, it's an inspiration that we all should look after. And for me, sir, at 8:30, maybe 3 to 4, so 4 days, twice a week, the mock session was my class. So I was waiting when the mock session will be there so that I can ask all my doubts to you and I can clear all my doubts. And sir, as I have told, for me, you are a magician. I'm not just telling words. I mean my words. And sir,
No, no,
so
no.
to
No,
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 sir,
no, no.
I'm being very honest. For me, if you are not there, I don't think what could happen. But God has been very kind that I met you. And sir, to start with the syllabus, there is a, I think in the YouTube, there is in search channel, there is a preparatory channel that you all can see how to prepare for that. But about the course, like all of my colleagues have already answered. Dr. Uma, Harshal, Aishwarya, everyone has answered everything. But I would also want to tell one or two things that might help some of our candidates. Uh, like first of all, you have to finish up your syllabus first. You may take 2 months or 15, 20 days more, but you have to finish your syllabus first. Then the most important thing is not about how many revisions that you need. It's all about understanding what's your strength and your own weaknesses. Then you have to first address your weakness at the beginning because it takes a bit time. And then in the later part, you can strengthen your own strength. And about the exam, you have to pass knowledge and skill separately. Unfortunately, one friend of mine has very good marks, but unfortunately, he has missed it by, I think, 2 marks in the skill. So you have
One
to
mark.
prepare the knowledge. Yes, you have to prepare the knowledge and the skill separately so that you don't mix. Sometimes what happens, we think that we are very good in anatomy, critical care, pathology, and communication, but we tend to forget about the clinical examination and history. So you have to think a set of knowledge and another set of skill to study individually and understanding what is your strength and what is your weakness. And in this exam also, like in the part A, like there are MCQs, so you can never score 100%. So like that also, here you cannot answer each and every question. So don't feel that you have missed one or two question. And like Dr. Herschel has already said that they have a answer key with them. So try to be bullet on point, like Dr. Alam always answers very specifically. And you don't need to explain more about the answers, because it's very good to know, and but it's better to keep it to yourself in those 9 minutes of the exam. And in the knowledge part specifically, I want to tell one thing, that sometimes there are 10 or 11 questions. Sometimes they will ask, what is the structure, what is this nerve supply, that means it carries 2 marks. Sometimes they will ask about, name 2 risk factors for this gastric cancer that the patient is having, or name 2 complications of hypothermia. So you will have an idea that this question carries 2 marks. Sometimes what happens, you might take some more time at the beginning, but the skill station, there are 6 and 3 minute, and knowledge, there is 9 minutes as a whole. So after 6 minutes for the skill station, there will be a bell. So in the knowledge section, if you are just going just a bit late, you can have an idea that you are getting a bit late and there are only 3 minutes that is left. So you can be quick in answering. So that you have to keep in mind. And about the anatomy, the pictures are different, but they are very clear. You can easily identify them. And pathology also, pathology and critical care, it is almost the same that we actually studied. But one thing I want to tell, that in knowledge part, every question comes from the notes itself. Mostly 95% of the question will be from notes, or even 100%. The thing is, when you don't know the answer 100% right, don't try to go hard at it, or don't try to utter a single word, because they will mark it. Even I'm telling you this because even 99% surety is not 100%, because this has happened to me in knowledge section. Like they have asked me a muscle, and I thought that I know this. Then I answered that. Then the following question was, which was its nerve supply, and I answered that. Then after that, I realized that in that picture itself, the sartorius muscle was cut from the anterosuperior iliac spine, which I have missed. So you should look at the picture. If you have any doubt, just say that I want to skip this and I want to cover it later, and they easily allow you, and they easily ask the question afterwards. The thing is, you need to pass the station. There are 17 stations. You need to go one by one. Don't try to think what will be the next station, or what is there, what it went wrong in the last station. See, from the 20 marks, there will be 14 easy marks for everyone. So you need to just answer those 13, 14 marks and get your 14, then come back to 4, 5, whichever question you are having some doubt, and then try to answering the remaining 5 or 6. In between those 6 to 8 minutes, your brain has already formulated some answers, and you will definitely answer 2 or 3 out of those 5 or 6. And if you are lucky, then you can answer everyone. See, the thing is, whenever you are entering the station, they are noticing everything that you do, even hand washing and everything. So just try to be confident and try to capture every moment, and just try to leave these hours. And this exam is very well organized. So this is not a poorly conducted exam. So you will not feel anything is missing. I know there is a lot of doubt. Even I had some doubts, what will be the instruments, how it goes on. But once you enter, every step will be clear to you, and just enjoy that process. Try to. And in spite of everything, there will be 1 or 2 answers which you won't be able to recollect, or will miss, because we all are humans. So the thing is, you have to accept it and move forward to the next station. And next station is a whole new thing. This is not the thing that you have to think like I have missed 1, 2. In the next station too, there are 20 marks. Even if you wash your hand, that is 1 mark. Introduction, hi, hello, I am Dr. something, that carries 1 mark. So there are marks to grab. You can just grab your marks. There will be be 5 to 10% of the answer that you cannot give. So just you have to leave that part. And about the thing, sorry. And about the thing is, after you have entered the station, like don't try to. We all are anxious. We all get nervous, but we should not show that on our face. We should not try to show that in our face, because if you will see the numbering of the RCS, there are for professionalism, I think there is 48 marks, and for all the behavior and all the empathy or sympathy that you show to the patient. So you have to be confident, you have to be humble, you have to be very polite, and you have to be listening to the patient actively. And all these things are not only important to grab your marks, but these are also important to, like, these things will make your process easy. When you are listening to the patient actively, they will not interrupt you. But when they will notice that you are uttering a like rash word or you are hurrying, they will try to trouble you, because they are all professional actors who have been doing this since long. So try to, whenever in examination part, whenever you are trying to touch the patient, you can ask them gently by taking consent and always. And everything is there in the sir's notes, and he always makes it very clear, like the 10 steps. Whenever you are going into a station after reading the question, think about the 10 steps or the 5 steps, whichever is there. Like I've talked to Dr. Uma after her examination. I was also thinking Dr. Uma had said that she has forgotten to wash her hands in all the stations. So I was ready that I'll wash my hands. And there were two set of sanitizers, one outside and one inside. So I actually washed my hands outside, thinking that I have done it, and I was very happy. But going inside, I never thought of that, so I missed that hand washing inside. So like Dr. Harshal and Dr. Uma has already said that whenever you are entering the station, try to look everywhere. You will have your answers, which things to use, like there will be a BP, Spigmo, you have to measure the BP, there will be a Doppler, there will be some pins, but there are things, and just have a look. You will have the idea. And the thing is, I really feel for some of my colleagues who I think they are even better than me, or all of us that who have passed, and I really feel sorry for them. But it would have been great if everyone could have made it. But I believe that every one of them will come stronger and will do even better than all of us. And you people who will be taking the exam in coming sessions will also do even better than all of us, because you are already with Dr. Atiksha so early in your preparation. And even though you do it now or later, this exam and its preparation, that I want to tell, that definitely makes you, me, and all of us a better surgeon. But before that, it makes us a better human being. So I want to say all the best, my friends. And throughout the journey, please take care of like the basic things, your food, health, sleep, and of course the mental health. Try to sort out and talk to someone about your feelings, be it anger, frustration, or anything. You can try to reach out to anyone that you feel comfortable about. And so the one thing that I want to say, that you all are here in this meeting, says that you already are in the right path and with the right person. And if I can help you people, I'm always there. And I'll miss the discussion session and the lead up to the examination. I always enjoyed all these things. And I have enjoyed my time with this wonderful group. And now it's your turn, my friends. And thank you so much for giving me the opportunity, Atik sir. I'll miss you a lot. Thank you, sir.
Thank you, Dr. Akash, for your wonderful experience sharing with your success. Congratulations once again, and good luck for your future. Okay, I hope we
Thank
will
you, sir.
meet. Okay, and
Definitely, sir.
we will hug each
I,
other. Okay,
I have a
someday
Yes,
in
sir.
question
life.
for
Definitely,
Dr.
sir.
Akash.
Yes,
Yeah, I
Yes,
have a
Dr.
question.
T.
Yeah, I have. First of all, congratulations. I'm so happy for
Thank you.
you. And
Thank
yeah,
you.
I have actually personally informed, like conveyed your regards to Dr. Atik.
Yeah, yeah. Thank
yes,
you for that.
Personally,
I really wanted to
okay,
meet
you're
Dr.
welcome.
Atik in any
Okay,
hands-on, sir.
yes,
I
Dr.
still
Akash. What
think
right.
happened? On the
I
fourth day,
yeah.
on the fourth day when I entered the venue. Dr. T was
Yes,
running towards me. I thought like, what happened?
yes,
Dr. T was saying like, I'm saying thank you on behalf of Dr. Akash. I am so impressed.
yes. Sir, actually, I was really excited about the hands-on, and I also told you that I still think it's not about giving the exam. It's not about attending the hands-on and going to the exam and getting some marks. It's all about learning, sir. While talking to you, I mean, I just learned how to talk to people better. So I just want to meet you, nothing else, sir.
All right. Okay, inshallah, we will
Yeah,
meet.
actually, I
No
wanted to
problem.
ask the Akash because he's a brilliant candidate. I just wanted to ask him, like, how important is this muscle attachment and all? How often is it coming in the exam? Like in your station in anatomy, did they ask a lot of muscle attachment, origin, insertion, and all, or was it just to identify the muscle and just nerve supply and stuffs like that,
Yeah.
or were they asking
Okay.
like every like
Okay.
multiple
See.
level question?
Okay.
Yeah.
Okay, see, from the anatomy station, if you will ask, there will be one question from the head and neck and neuroanatomy part. So head and neck.
Okay.
In that part, they don't go deep inside the muscle attachments. They simply ask about
Right.
the triangles, the boundaries, the carotids, the branches, the nerves, the nerve injuries, the palsies, everything. And there will be one question that will be coming from thorax or abdo. It might be mediastinum, it can be heart. So in my case, I got, I think it was heart, and they asked also a few things regarding the diaphragm opening and all. So see, there are three stations, right? So one will be from head and neck and neuro. One will be from the limb, like upper limb and low limb. In upper limb and low limb, they will ask you the attachments of those muscles which are only important. Nothing like
Okay.
they will not never ask you a attachment of a small muscles. And there will be a question from the thorax and abdomen also. So you have to, like I said, you have to be very thorough. Like you have done your anatomy, but you have missed that part. You might miss a whole station where you have to
Okay.
be thorough with every subgroup of that whole subject. Like you have
Okay.
covered anatomy, but you have to cover head and neck and CNS for one station. You have to cover the limbs for one and this for one. And another thing is, in case of like pathology, there will be one carcinoma that will be coming, and there will be
Okay.
one from the general or something. So you have to be thorough in that part. And in critical care, in pathology, we got the gastric carcinoma and osteomyelitis with abscess. The questions were all the same questions, even in anatomy, all the same questions. And in critical care, what they do is they ask one from the CRISP, one from ATLS, and one from something covering the physiology part that you will get to know when you will be seeing the
Okay.
index. So in the ATLS part, my station was with the head injury part. The question were all same, like Dr. Herschel explained. It was all the same. They're asking the same question. I was giving them the same answers. The sequence was also like same. Then there was a critical care station, and there will be a question like critical care was the septic shock, and there is always a question from a
Okay.
physiology aspect like that of I
Yeah.
think I got a hypothermia. So
Okay.
by this, you have to prepare one ATLS. So you have to be thorough with ATLS. You cannot leave the ATLS part, because you will be having a question from this trauma, one question from the CRISP, another question from this physiology part. Then
Also
coming
from
to the,
yeah, yeah,
sorry,
please
Dr.
continue.
T.
No, please continue.
Yeah. And then the question were all same. In knowledge, every question was same. There will be hardly one or two question, but the question and station were the same. And then coming to the skill station, that I want to tell that even in the suturing station, like they will try to mess with you, but don't fall into the trap. Even they will be opening the suture for you. Always ask about the expiry date, because those things are important. I was continuously asking about the expiry date, and in the third, like the probably in the examiners, that told me it is 2028, doctor. You don't need to worry. But you have to ask those things. Actually, you need to say that I will wear gloves. They will say that no, the gloves is not required, sir. I want to wash my hands. Consider it is done. They will guide you. Then you have to just pull out the procedure in front of them. And in case of the procedures in which there will be a real patient, enter the station and then always try to follow all the 10 steps that Dr. Atik sir says, but in identification part, in the patient that I should tell all the candidates, the patient always have a bracelet, the identification bracelet, but they tend to hide it below their sleeves. So you have to ask that, can I please check your bracelet? Then they will be like, then they will show you. Then you can easily check that. But for the identification purpose, like in the station, I think there was Mr. Jacob or something. It was written, but in the station itself, it was a female patient, 30 or 35 years old. But you have to consider that, hello, Mr. Jacob. Then she will greet you. Then you have to ask that, can I check your bracelet? In the bracelet, the name was written Jacob and the date of birth. So you have to take care of that thing. And all the instruments, they usually give it by themselves, they give it very promptly. They don't delay it. And if the patient is asking about pain, that means you have not infiltrated any part of the skin, that you have to have a hint. Whenever a patient is trying to tell something or interrupt you, try to take it positively, that the patient is trying to give me a hint. So whenever the patient is saying, if the patient, like I'm talking from experiences of my friends, that if the patient is telling that pain, then you have to like anesthetize the other parts of the skin as well as a whole, like in abscess drainage. And before putting the incision, you have to check if the patient is having pain. These are very small steps, but in the real exam, we tend to forget. And after the procedure, we always tend to forget documentation and disposal. And after the disposal, usually we think that we are done, but the documentation part you have to remember. So this is all about the procedure station. In the history station, it is you have to be asking the questions like you do in your mocks. The 6 minute is usually enough. And like one of our colleagues was asking a doubt regarding if the patient is being very talkative. Actually, in that case, when you have to interrupt, don't try to interrupt in a harsh way. You can simply interrupt by telling that, sorry to interrupt you. Can I please ask you this thing? Then they will stop. Then they know that they will have to stop. So in the history taking part also, after the 6 minutes, you can summarize and tell all the things. But throughout this procedure, try to be as polite as possible and try to listen to them actively. In our practice, usually whenever the person is telling us something, we don't receive it actively. Although we are listening, we have to show them in our action by nodding our head, by eye contact, that we are listening to them actively. So this is all about the history, and try to go with the flow. Don't try to present yourself like you have mugged up some things and try to note down just the positive 2 or 3 points. Then it will be done. It is then the clinical examination part also you have to go through like the 10 steps. But as Dr. Harshal said, like I had my clinical examination station at the beginning. So I don't think they were well prepared. The patient, I think he was a new patient. He was not understanding English, and the chaperone or the like attendant was just outside. So I had some difficulties, and also unfortunately the examiner was not that cooperative in those early 2 3 minutes, so I could not finish it. But if whatever is the case, you can ask for a chaperone and follow all the 10 steps. Thank the patient before touching the patient. Ask if the patient is having pain. If the patient says that, yeah, doctor, I'm having some pain, just offer them painkiller. They are expecting that answer. In their answer key, it is written that if offering some medication, then after offering the medication, they will say that, no, it's fine, we can go. And after the examination is done, always ask the patient to be repositioned and to dress up. We tend to forget this, but try to remember. And these all carry mark. We always miss, and we should not miss all these easy marks. Then coming to the communication part in the phone call station, Dr. Uma was telling, they basically check your integrity if you're telling the truth, or they just check if you are playing with them. So they will ask if there is a cervical collar, if the fluid chart is there, if the ECG is there, what happens, in the previous station, there will be the case file that, but they knowingly will not be putting the ECG there, because in our notes it's been written that yes, we find ECG, yes, we have seen that the urine volume was 1100 ml. So they try to check that if you are answering to them honestly or not. In the phone call station, the examiner is not there. So they basically check your integrity, nothing all. And the thing is, whenever they're really telling, like, if the patient is wearing a cervical collar, then you'll be telling, sorry, sir, I haven't checked it. But as soon as I'm getting over the phone call, I'll be checking the collar and telling you. But then they say that, yes, after you have checked the collar, please make sure you contact a neurosurgeon or something like these small things. And they ask all these small things after the phone call. At the phone call, when it's about to end, they will ask that, okay, tell me what are the things that I have told. Then you have to tell that, yes, I have to call for the neurosurgeon. I have to put the splint. We have to give the patient this, and this drug, and send this investigation. So this is basically it. And in person, basically the thing is, you don't have to remember everything, but you have to know if the operation has been cancelled once or cancelled twice, or what investigation has already been done. Like these things will help, because sometimes, if already you know that the patient is postman, you have to be sure that the patient is postman, so that you can give advice to them accordingly. And they will be guiding you through, like, doctor, I am taking this medicine, what can I do? Then you have to say that, yes, we will stop it, but you should not be saying that I will stop it, because you are not the consultant here. Like in our practice, in the parts where we actually practice, like, we can prescribe something, but what they basically trying to see from you is that you are a good person who will talk to the consultant and then get back to them. You cannot make false promise, or you cannot prescribe the drugs by yourself. So these are the basic things that you remember, and try. And in the communication part, don't try to interrupt the patient. Listen the whole thing, then show empathy, then go very slowly, and they take all your words. And this is all the things about the station, and all the tips and all the station are there, and you are followed with the magician. You don't have to worry about anything.
Thank you, Dr. Akash. Thank you so much once again. All right. Anyone
Thank you,
else
sir.
wants to ask anything?
Sir, I just want to tell one thing. In my anatomy station, I had tibia and fibula, medial aspect, lateral aspect, and anterior aspect. Pictures were given, and they asked to match both of them, like like articulation. That was
Yes.
asked.
From
So
picture
that's
1 to picture
important.
2, which
Yeah,
parts are
picture 1 to
articulated
picture 1.
together? Yes.
Yeah, that was there. A, B, C. That will be labeled like A, B,
Yes.
C,
Yes.
and then they will ask you to articulate. So that was
Yes.
important. Similarly, they will ask for muscles that is causing. Can you show me the muscle that causes inversion? Can you show me the muscle that causes eversion? Or they will ask you to name all the muscles of the foot from start to end. All the tarsal bonds, first metatarsal, all the
Muscles of
bonds.
the legs and the
Yeah,
bones of the foot.
yeah, yeah, foot, everything. So that foot and hand part is very, very important. So I just wanted to stress on that. It is very important.
Yes, especially the extensor surface of the hand and
Yeah, yes, sir.
the medial and lateral part of the foot, especially the ligaments and the bones.
Foot sub questions are all exactly like what is given in sir's note, like attachments of the deltoid ligament, then the type of joint, what are the angle joint, what is angle joint, what is the type of
Yes,
angle
the
joint.
foot
Yeah,
arches and all that stuff.
yeah, yeah,
Yes.
yeah. What fracture is seen along with some lateral malleolus fracture, some is there, na? It's everything in
Mhm.
sir's note. Yeah, that was also asked for me. So exactly in
Sir, in the
sir's note.
anatomy, yes, like Dr. Uma said, like I was also trying to tell that one station will come from the limb. It will either come from the upper limb or lower limb. From the upper limb, they will be they are usually giving the hand part, and even some UK centers they were giving some the rotator cuff and the shoulder part, and in the lower limb they are giving the ankle, all the ligaments, and the thigh part. As the thigh part has the largest structures, so it is very easy for us to identify, but it becomes a bit confusion when it comes to the ankle part. But in the notes that sir has, that has very clear picture. So you just have to go in detail. And in the hand and foot, you should revise because it's coming very frequently.
Excuse me, sir. I have a question. Can I ask?
Yes, go ahead, please.
I have a question regarding the past recalls, how important they are, and which past recalls we should focus, the recent year or the center wise. Can you guide over this?
Yes, the thing is actually all the question that you are covering in the
Okay,
notes, all are the recalls.
let me
Yeah.
clear it.
Yes,
Let
sir.
me clear it, Akash. The thing is, it's not like part A. Okay, so everyone is asking for the recalls and recalls and recalls. The thing is, the notes has been made out of the recalls. Okay, and all the questions which can be asked to you in your exam that has been added into these notes. Okay, as it is. So the notes are made up from the recalls itself. So the thing is, it's not about the part A that you go and read from the EMRCS or the past test, and then you go for the recalls itself so that you can have the similar questions, right? So it's don't confuse yourself for part A and part B. So the thing is, for part B, the notes you're going to have, it's all from the recalls, okay? So, and you have to have the most updated version of the notes, whichever you are following, okay? And the thing is, what I do is I collect all the questions because after every exam, the candidates, I talked with the candidates and I asked what are the questions that has been asked. If I see if there is any new questions, I just simply add those things into the notes, right? So you don't have to go for any recalls. That's my promise to you, okay? Because every time I said, if you follow the notes, you will have almost 90% covered up because the 10% you cannot cover. This is the standard of the RCS, okay? But if you are very, very talented or genius, or you covered all my classes very like efficiently, because in the class, what I do is, other than the notes, I try to give you the ideas how this is happening and what are the things we have to go for. So the views of the context, right? So that you can have the concept behind the scenarios you're going to have. So please don't about the recalls. It's just like something everyone is talking, but don't go for that. Okay. The thing is about the uh, repetitions of the stations of the same center, you can like search for that. What are the stations is there? Suppose you are going to give your exam in Hyderabad, okay, in January. So you can search what are the stations that came in past days, okay. So it's about asking for the stations, not for the recalls, because everything is added. I hope I cleared your question.
Yes, sir. You cleared it. Thank you so much.
No problem. Just don't confuse yourself because lots of people are asking me about the recalls. Please don't go for it because you will lost your mind. Okay, there are lots of like some questions has been accumulated in the PDFs, and those are confusing and those are not being asked. Some things are very old from 2015, 16, and something like that. So the candidates are getting like some misguided. Okay, so they are trying to search those answers, but they are like forgetting the most important things that you have to follow is the simple notes you can have from all the courses. It's almost the same thing you're going to have, right? Whichever you're going to follow. So you have to cover your syllabus first. Stick with the common questions first. Then if you covered it fully, Then you can go and search for the few questions. Maybe those are not that much important as well. Because for the last 1 year, I'm just collecting and I'm making as much as questions in the notes, okay, from every sources just for you. So you don't have to go for the other resources. Like you don't have to like ask like what are the questions, what are the recalls? No need. Okay.
Thank you, sir.
No problem.
I have one question
Yes,
regarding
Dr.
the
Farhan.
course and mock. Is it going on or will it start sooner?
The mock,
Is there any
the mock.
ongoing
Yes,
classes
yes, there
and
is a
mock?
yes, it's ongoing. Yes, in the course group. Yes.
Okay, so if I join, then I would have missed many things.
When is your exam?
January, Hyderabad.
Yeah, don't worry. You have a lots of time because right now what we have is ongoing for the candidates of September and October, and from the October 1st we will start from the very beginning, and that means you have a lots of time in your hand, and you will have a very nice exam. Don't worry, Dr. Farhan. Okay.
Okay, okay.
All right.
Thank you.
You can join so that you can prepare your early. No problem.
Yeah, and regarding the class, as my schedule is hectic, I get
Mhm.
time after only 7 or 8 p.m. So is it sufficient in the night, 2 to 3 hours of a study with the class?
Yes, of course. Of course.
Okay.
All right, let me finish it. Dr. Akash, thank you so much, okay, for sharing your experience with us. Okay, I
Thank
hope
you,
I
sir.
will meet with you. And please
Thank
try
you, sir.
to
Definitely,
help,
sir.
yes, try to help all the future candidates as much as possible, okay?
Yes, sir. I'm always there.
All right, okay.